Thank you, Julianne. Hi, everyone. My name's Sam, and joining me today would be Darius, Katie, and Sean, and we're going to be talking about health insurance, particularly really jargony words. We're going to try to break that down for you. Medicare and Medicaid, which are some programs that you might be eligible for. So the objectives of this presentation is to really understand what health insurance is, maybe like why we need it or like why it's important to know about it, the differences between what an HMO plan is and a PPO, what it means to have a premium or what it means to have out-of-pocket expenses. Also, again, Medicare eligibility, how to enroll, and then what coverage looks like once you get it. And also Medicaid eligibility, enrollment, and what coverage looks like when you get it.
So just as a disclaimer, there'll be a lot of info on the upcoming slides, so please feel free to not keep up. We do not have much time to go over all the details, so what we may say will not cover everything on the slides, and we'll make sure to share these slides afterward.
Hey everyone. So what is health insurance? Health insurance or healthcare in the US can be very expensive, whether you need to go to the doctor, get surgeries, get medications or equipment. And so health insurance is a way to help you pay for some of that. And so what happens is you pay a health insurance company a monthly or annual amount of money, and this is called the premium. You may have heard this before. In exchange, the health insurance company will help you pay a certain amount of money when you need healthcare services or equipment or such. And how much they pay will really depend on the plan that you have. And so here are some common health insurance types of plans that you may have heard of. HMO, a really common example of that would be Kaiser. And so the way that works is it tends to be cheaper in terms of how much you pay monthly or annually. And in exchange, you have a little bit less flexibility. So whenever you need any kind of medical care, you first see your primary care physician. And then if you need to see somebody else, like a cardiologist, for example, the primary care physician will send you a referral or send a referral to see somebody else. And you can only visit providers that are in the network, and they won't pay for healthcare outside of the network unless it's an emergency. On the other end of the scale, we have PPO plans, which are a lot more flexible, but they're more expensive. And so you don't need to see your primary care physician. You can schedule on your own whoever you want to see. And they will also cover doctors that are not in the network. It just might cost a little bit more. Next slide, please. And so we're going to go over some examples to teach you some of the terms that you may have heard of before, using Sally as an example, who has health insurance. But I mean, this could be your mom, your uncle, your brother, your sister, really anybody. Okay, so on this slide, we'll cover what happens when, for example, your uncle gets sick. So say your uncle gets injured, nothing emergency related, but maybe he feels not well, and so he wants to go to the doctor a few days later. So when you go to the doctor, you pay maybe like $20 for the visit. This is called the copay. It's an amount that you pay every time you get some kind of service. Now, maybe you go to the doctor for a while and then they decide that you need an X-ray to see what else is happening. And so if you haven't met your deductible, then you may have to pay for everything. Now, if you have met your deductible, you may only pay a small percentage of that cost, maybe 20%. So if the X-ray costs $100, then you pay $20. So the deductible is the amount of money that you have to pay before the health insurance will start helping you. And the co-insurance is the percentage that you pay for things. And again, these all depend on your health plan. Now, maybe you get an X-ray and then they figure out that you need to get a surgery, for example. So if you met your out-of-pocket maximum for the year through anything that you've paid for so far, then you won't have to pay for anything else. So if you met your out-of-pocket maximum for the year and you need a surgery, for example, then the health insurance will pay for 100% of covered services. Next slide, please. So another common plan is called a high deductible health plan. This is a type of plan which has much lower premium, so you pay a lot less per month or per year, but it requires you to pay more for out-of-pocket costs. And so this plan generally works better for people who are younger or healthier. It's just basically people who don't need to get a lot of healthcare services, and so they can get away with just paying less money every month or every year.
Alrighty, so now I'll go over Medicare. So Medicare works just like regular health insurance. However, you do need to pay premiums, deductibles, and copays. Medicare is a federal health insurance program for people over 65, younger people with disabilities, people with end-stage renal disease, and you must be a U.S. citizen or permanent resident who has lived in the U.S. for 5 consecutive years. Okay, so there's 4 parts of Medicare, and for Part A, most people don't need to pay a premium if the patient or their spouse has paid enough Medicare taxes during their career. For Part B, everyone pays a premium of $144.60. And for Part D, you must purchase a separate plan to cover prescription drugs. So each plan has a different premium and copay.
So to go over a little more of what the Medicare covers, for Medicare Part A, this is original Medicare consists of Part A and B. So you don't need to go to your primary care to get a referral from your visited specialist. For Part A, this is the hospital insurance, and this covers inpatient hospital visits and nursing care and many things like that. And for the next one, original Medicare Part B, Part B is the medical insurance, and this covers medically necessary services like ambulance services and medical equipment, or preventative care, like when you visit your primary care provider, or mental health care. Original Medicare's Parts A and B do not cover many things like dental, eye care, and hearing aids though. And the last part is Part D. So Part D must be bought separately from the original Medicare. So this is the one that covers many prescription drug insurance plans, including like insulin, high blood pressure medication, and all or almost all drugs in these 6 categories of antidepressants, antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and anti-cancer. So each Part D plan will have its own list of covered drugs that you can ask your insurance about. And for the last part, Part C, so this is A plus B plus D. So this is known as Medicare Advantage, and this covers all services and needs. This must also include Part D, and this includes the vision, dental, hearing, and wellness care. So Medicare Advantage plans are like HMO, in which it's generally cheaper also.
Okay, so here are some ways that you could enroll in and apply for Medicare. Either just on the Social Security website listed right here, or you could call that phone number 1-800-644-4227.
And for the enrollment period in Medicare, there are 3 periods in which you want to enroll, which you can enroll. The first one is the initial enrollment period. So this is the 7-month period that includes 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So you really want to make sure you enroll in those 3 months before your 65th birthday, because then your coverage will start right when you turn 65. Otherwise, if you enroll right when you turn 65 or a little bit afterward, you'll have to wait 1 to 3 months to enroll until you get coverage. The second one is the special enrollment period, and with this one you can enroll anytime as long as you, your spouse, or family member, if you're disabled, are working under an employer that provides the insurance. And the last one is the general enrollment period. So this starts between January 1st and ends March 31st, and your coverage will start in July. But with this one, you usually have to pay a late enrollment period penalty. So you really want to enroll in those first 2 periods. And also just another note is that if you qualify for Medicare, the fee to apply is $599 to process each enrollment application as of January 2021. And also, if you delay the application, the fee becomes more expensive every year after you turn 65, you're not enrolled. So you really want to aim for those 3 months before you turn 65.
So now I will be talking about Medicaid, which is another program that's available. And Medicaid in California is actually just called Medi-Cal. And so if you hear Medi-Cal, just know that it's Medicaid. So what exactly is Medicaid? Medicaid is a federal and state program that helps with medical costs for some people with limited income and resources. I'm going to delve into like what that means in the next slide. So for Medicaid, how you have to be, or like what makes you eligible is that you have to be a resident of the state of California, a US national, a citizen, a permanent resident, or a legal alien. And so then after that, after you meet that requirement, you have to fit in one of these qualifications on the next 3 slides. So one of the qualifications that you can enroll one of the qualifications that you can have is based on your income. And so what exactly does it mean to be low income? Well, for example, if you were in a house of one, you would have to be making below $16,395. And so it really just depends on what the household income is and how many people are in your household. So that's what it means to like be low income for Medicaid eligibility. One of the other things that you could qualify for Medi-Cal for is based on any programs that you might be in. So for example, if you're in CalFresh, then you could apply for Medi-Cal and see if you're eligible that way. Or lastly, one of the other possible qualifications to enroll in Medicaid or to get Medicaid insurance is these things. So 65 and older, blind, disabled, under 21, pregnant, residents in skilled nursing or immediate care homes, people with refugee status for a limited time, parents or caretakers of disadvantaged children under 21, and people who are diagnosed with breast or cervical cancer. So things that Medicaid covers once you get it is things like preventative screenings, mental health services, physical therapy, prescription drugs, dental care, home support, long-term nursing home care, optometry services, substance use treatment facilities, pediatric early period screening, diagnosis, and treatment. And so something about Medicaid is that it usually offers really cheap insurance. Sometimes the premium is like $1 per month, and it really just depends. And then there are multiple ways in which you can enroll in Medicaid, but the one that I've provided here is that you can apply to Medicaid through this website called Covered California, and your services are available in Tagalog, and you can also call a number listed right here on the screen if you need assistance on it. And right here is just kind of a screenshot of what the website looks like. Now I'll be kind of going over what open enrollment means and like what the website looks like and how to enroll. Something really cool about Medicaid is that you don't have to be like there's no time span in which you have to enroll in it. You can enroll in any time. And if you want to discontinue your insurance and maybe see if you apply for or like are eligible for Medicaid and can get it, then you can also do that. Again, there's no timestamp on it. So this is what Covered California looks like. You're going to go to the Can I Get Financial Help area, and then you'll press continue. And then after that, they're going to ask you a question based on your household size. And then you can say yes, or you can say, no, I make more than that. If you click onto yes, though, they'll have you in this area where it says, how do I apply? And it'll tell you exactly how to apply right here. Again, you can apply online or with in-person help for free with an agent or through the phone. And it usually takes about 45 minutes to apply to it. And then once you apply, if you choose online, you just click here, this and that, and then it'll give you all the options. So yeah, that's basically it. After that, it'll just ask you all the other questions that you need for enrollment. And now we'll be going to the summary of this.
Alrighty, so I know that was a lot of information. So yeah, we made a brief overview right here comparing Medicaid versus Medicare. So basically Medicaid coverage varies state to state, while Medicare coverage is consistent nationwide. Medicaid is a federally and state funded program, while Medicare is just a federally funded program. Medicaid is mostly free. However, there are a few small charges, and for Medicare, there are annual deductibles and co-insurance. Lastly, Medicaid mainly targets folks with disabilities, low-income populations, and pregnant women, while Medicare is mainly for people over 65 and people with disabilities. And lastly, again, just to note, Medicaid is called Medi-Cal in California.
Just as a reminder, we'll make sure to share these slides afterwards. So here's some links that you can look at for more information about Medicare, Medicaid, market to shop for health insurance, how to enroll in Medicare Advantage, and a phone number if you need help over the phone and with a live person.
And here are just some slides on resources for children. And so there's something kind of like Medicaid, but it's specifically for children, and it's called SCHIP. And so if you wanted to apply for your child, or if you know someone who wants this, feel free to get this. And write down this number or this website. And again, we'll be sharing these slides and these resources afterwards. Another thing is the Kaiser Permanente Community Healthcare Program. And so if you don't qualify for SCHIP, this is another way to get some assistance in paying for health insurance. And then here are just some local resources. And so Health San Francisco is a program to make healthcare services available to uninsured San Francisco residents. And that's regardless of your immigration status, employment status, or any pre-existing conditions. And essentially what pre-existing conditions means is just having health conditions before you even apply to like these services. And then we've also given a comprehensive list of 25 clinics that are available across San Francisco for free or low-cost healthcare services.
All right, thank you everyone for tuning in and listening to our presentation on insurance. The presentation slides, as well as other helpful, will actually be linked on our Linktree website, which is linktree/MHC_PH if you want access to it again or need other references. Again, thank you so much for taking time to be here today.